living safely with disabilities and special health needs. Advocating for school safety.
It is important that all students are safe in school. Many students have vision, hearing, mobility, sensory, learning, and developmental or intellectual disabilities. Ask students and their families their safety concerns and if they need any assistance in an emergency. Offer individualized plans based on each student's needs. The National Fire Protection Association and other organizations provide a personal school emergency evacuation planning checklist to assist in this preparation. Identify students who need assistance during an emergency. Be sure to incorporate these needs within school safety plans and within each student's IEP. Identify everyone who should be a part of a student's plan, including parents, service providers, personal assistants, physicians, therapists, and others. It is important for teachers and administrators to observe the responses and reactions of students and staff to identify any accommodations that may be needed in a real emergency. Be sure to assess the school environment for hazards and barriers for safe evacuations for all students with or without disabilities. Consider classroom locations for students with physical impairments to ensure they have a safe exit out of the building. Identify and communicate predetermined evacuation locations a safe distance away from the school building and away from traffic areas that may be used by emergency responders. Within your school's safety plan, keep a current list of all students' equipment and support needs and how a fire, disaster, or other emergency might affect their use. Some of these include communication devices, wheelchairs, and other mobility aids, as well as other supportive equipment. Include emergency responders in the education, training, and drills as much as possible. Plan for additional consideration during times of bad weather when students might need additional accommodations to protect themselves, including the need for transportation to medical facilities or other indoor evacuation locations. It is important that all safety education, resources, and alerts are understandable and relatable for all students, including those with learning differences, developmental disabilities, vision and hearing impairments, and other disabilities. Involve and empower students in lessons about prevention and response. Be sure that all alerts and notifications are accessible and effective for all students. Incorporate both sounds and visual alerts and alarms in all areas of the school. It is important to let everyone be familiar with all sounds and sights that can be expected. Use short instructions in plain language accompanied by pictures. Some of these statements can include, "This is an emergency. Exit the building at door number 5. Do not use the elevator. Go down the stairs." As administrators, our number one job is to keep our students safe. When our students feel safe, they are able to learn. It is important to involve our students in the safety planning process, including those with disabilities. This is Living Safely.
Let's live safely together. The information contained in Living Safely with Disabilities and Special Health Needs, Living Safely, is provided for educational and informational purposes only. The content contains general information and may not reflect a person's individual needs or current legal developments or information. Children's Specialized Hospital makes no guarantee, either communicated or implied, about the accuracy, application, appropriateness, or completeness of the information within Living Safely, or at any other website to which it is linked. Children's Specialized Hospital specifically relinquishes all liability with respect to any person's actions, taken or not taken, based upon any or all of the information or other contents from Living Safely. Thank you to the Newmark Education students and staff and the Film Academy 360 production team. Children's Specialized Hospital, an RWJ Barnabas Health facility, is the nation's leading provider of inpatient and outpatient care for children from birth to 21 years of age facing special health challenges. From chronic illnesses and complex physical disabilities like brain and spinal cord injuries, to a full scope of developmental, behavioral, and mental health concerns. This initiative was funded in part by an Inclusive Healthy Communities grant from the Division of Disability Services, New Jersey Department of Human Services.